Hair loss. It is a very huge topic to discuss. Medical term of hair loss is alopecia, a Greek word which means fox. It is thought to have been used because of fox mange when they lose their hair. We now use alopecia medically for all types of hair loss. Men and women both can face this. Hair cycle. There are 3 stages of hair growth. Number 1, Anagen phase. It may take 2 to 6 years to complete. Number 2, Catagen phase, takes 2 to 3 weeks to complete. Number 3, Telogen phase, takes 3 months to complete. Hair loss can be non-scarring or scarring. Scarring hair loss is where hair follicle has been destroyed and cannot grow back. Non-scarring hair loss is where the hair follicle is still present and can grow back. In this video, we will talk about 4 types of non-scarring hair loss. Number 1, Androgenic Alopecia, an uncommon problem but easily treatable. An increase in shedding triggered by trauma, stress, mental or physical conditions, nutrient deficiencies, childbirth, etc. Healthy number of hair enter into resting phase and create temporary hair loss. Shedding can last from 3 to 6 months or more, and then visible recovery may take 3 to 6 months or more. Androgenic Alopecia. Androgen is a class of hormones that includes testosterone, common type of hair loss in men and women. It is triggered by increased presence of DHT, dihydrotestosterone. It is a genetic problem encoded in your genes. This type of hair loss starts at the temples and crown in men, whereas in women, thinning of hair along natural parting is small in this type. It affects more than 50% of men by age of 50 and 50% of women in their lifetime. There is no consistent evidence that estrogen help in reversing this type of hair loss. Number 3, Alopecia areata. It is a common problem both in men and women. It is caused by autoimmune issues. Sudden hair loss results in bald patches. It can affect scalp, beard, and the body. Loss of hair is smooth in the form of bald patches ranging from 1 patch to multiple to entire scalp and or body hair loss. This type of hair loss comes and goes, often recovering completely, though recurrence is common. People with alopecia areata are more likely to have seasonal allergies, eczema, and thyroid problems. Number 4, traction alopecia. In the early stage, it is known as non-scarring. In later stages, it comes under scarring. It forms chronic tension on the hair follicle. It can be managed by reducing stress. Sometimes topical steroids or hair growth promoters can help. Causes of hair loss. General causes vary in men and women. Some common examples are unhealthy scalp, pregnancy, high doses of vitamin A, genetics, infections, increased activity of dihydrotestosterone hormone, stress, autoimmune issues, medical conditions, for example, high blood pressure, diabetes, insulin resistance, thyroid-related issues, vitamin and mineral deficiencies, iron and vitamin D especially, hormonal imbalances, PCOS, faulty hair care, and scalp infection. Treatments of hair loss. Zinc pyrithianone shampoo has been shown to be helpful for thinning hair. This ingredient can be found in many shampoos. Number 2, ketoconazole shampoo, 2%. This prescription has been shown to help hair growth as much as minoxidil 2% solution. Number 3, get your labs done. Your doctor can check your iron level, your hormones, and your vitamin D, as they all play important role in hair loss cycle. If your hair loss is related to low ferritin, then your hair should grow back once the underlying iron deficiency is treated. Still, it can take several months for hair to regrow. So patience is the key. Ferritin level of at least 50 nanogram per ml is needed to help hair replenish. Number 4, large amounts of hair loss, topical minoxidil and Rogaine may help. Usage of minoxidil and Rogaine is very effective for hair loss, but hair loss will come back as soon as you leave it. Rogaine and minoxidil is approved from FDA, but if you want to use it for long term, please always consult with your doctor. Usage of black strap molasses can also help to combat hair loss. It is available on health shops. Blackstrap molasses has iron and sugar content as well. People with diabetes must be careful while using it, as black strap molasses contains some sugar in it. Always consult your doctor for dosage advice. Normally, it can be taken as a tea, 1 medium tablespoon in 1 cup of hot water or normal water. Remember, do not consume caffeine for at least 2 hours before and after taking this drink. Number 6. Other available treatments are PRP, mesotherapy, stem cell therapy, platelet-rich fiber matrix, hair transplant in some cases, low-level laser therapy, usage of laser comb or helmet, antibiotics, steroids, immunosuppressants, supplements like Viviscal contain marine extract, zinc shampoo helps, iron and vitamin D are required for normal hair cycling. Topical melatonin has been shown to help growth. Number 7. Usage of biotin have shown some progress, but studies have shown efficacy of biotin for nails more than hair. Excess of biotin can cause severe acne. Our body only needs biotin in small amount. Number 8. Hair transplant surgery, also known as follicular unit transplantation, should be used in conjunction with minoxidil and/or phenytouride or spironolactone. This method will not work for Telogen Alopecia, Alopecia Areata, or against active scarring alopecia. It can show results for end-stage scarring alopecia. There are many myths regarding hair loss. Myth number 1. Does dandruff means you have a dry scalp? But the reality is dandruff is usually a sign of oily scalp. The scalp oil builds up, causes inflammation, and skin starts to flake off. Myth number 2. Will sulfate-free shampoos will help hair grow better? In reality, sodium lauryl sulfate is the most common sulfate shampoo and cleans very well. It can be harsh on the hair, but is effective at cleaning an oily scalp. If you use shampoo containing sodium lauryl sulfate, then consider using conditioner for your hair to prevent them drying out. Conditioner must be applied on your hair, not on your scalp. Thanks for watching. Please like, subscribe, and share. Stay safe and sane. Science will win.